This webinar is live, which means that the 4 panel members are sitting around the table with me here. We're actually in Alison Williams' office in Gweminar, so can I say thank you for hosting us this morning. Secondly, we are recording the webinar, which means after the event, we will divide the information into 4 sections for you to use as a resource. A number of requests have been made for that, for the purpose of to play back audit committees, for people to play back in their various meetings that they have once they've heard the messages. So if that works for you, let us know. If you want it in a different format, also please let us know. So without further ado, I'd now like to introduce us to our panel, if that's all right. And as you're on my left-hand side, Alison Ward, can I ask you to introduce yourself?
Yes, my name's Alison Ward. I'm the Chief Executive of Torvine County Borough Council.
Good morning, I'm Alison Williams and I'm Chief Executive of Gweminar University Health Board.
Good morning, I'm David Lloyd, Director of TPAS Cymru, which is the Tenant Participation Advisory Service.
Hello, I'm Fran Target. I'm the Director for Citizens Advice Cymru.
You're all very welcome to this webinar. In terms of engagement, we very, very much welcome questions from you this morning. There's a number of ways you can do it. The easiest way, if you look on your panel, there's a question box. Pop your question in there, and we'll hopefully get around to sharing it with the panel members. You can also do it by Twitter. We have a hashtag, which is WAO Experience. That's WAO Experience, hashtag WAO Experience, if you want to send your message in by Twitter. A couple of people have emailed and saying, I'd like to ask a question, but I don't want people to know it's me asking a question. Can I assure you, we are more interested in the question, because if you're asking a question, other delegates, I'm sure. So all questions are non-attributable. So if you're hearing a question that you want to give to a particular panel member, please can you say, this question is to Alison Williams, or this question is to Alison Ward, or this is to David Lloyd, or this is to Fran Target. If it's not specific, just leave that out if that's all right. So without further ado, I'd like now to open the first question of for the morning. So Alison Ward, I'll come to you first if that's okay. The first question I'd like to ask you is, does it matter what you call service users?
Well, I don't think it's about a label. I think it's about defining the relationship between the people that use our services and the people that we're delivering to. So are they clients? Are they customers? Are they people who really have no choice but to have the services that we've got? For me, they're customers. And if we think of them as customers, if we think about it as though we actually have to retain their custom because, as in the private sector, they could go elsewhere, then that means that we treat them with a certain amount of respect and we value them in a certain way that perhaps the public service hasn't always done. Some good parts have, some bad parts haven't. It's not very simple in local government because we have a vast range of people that we provide services to. We have people who want our services and approach us for them, such as planning, which of course is a regulatory service, but people come to us because they want it. We have people who really don't want us, like people in child protection situations who would much rather we went away. So how do we define that customer relationship? I think that's very important. And it is about how we treat people, and I do think that we have to keep in mind all the time that our customers can't choose to go elsewhere. And that doesn't mean we take advantage of them. I don't think it's just about directly provided services either. I've just been reading, I don't know if anyone else has, the report on Operation Jasmine, the older people's homes in South East Wales and the dreadful conditions those people were treated in. Now those were private homes, but the services were commissioned by Health and Social Care. Now if those people had been treated as people who had choices in their lives, that wouldn't have happened to them. So it is about respect, it's about thinking about them as customers, and it's about seeing what will best suit their needs.
Thank you, Alison. Thank you for that. Alison Williams, may I come to you next? So do you think it matters what service users are called?
It's quite interesting because in the context of health alone, we deal with a very wide and diverse range of people. The term patient is something that, ironically, people understand quite well. And whether it's a label, whether it's a term, however we define it, The relationship between a patient and a doctor is something that is often very clearly understood by members of the public. There is a value in the terminology, Dr. Jones is my doctor, I am Dr. Jones's patient. And when people are ill, defining that relationship and being called a patient is actually something that, in my experience, both as an NHS manager and as a clinician myself, is something that people value. But it's not the case across the whole of the health service, because we are managing people who are not acutely ill. So, for example, a mother coming to the NHS for maternity care is not ill, would not consider themselves to be a patient, and therefore, actually, you will find midwives and consultant obstetricians referring to them as mums or mums-to-be. And that is an important distinction. Where we've got patients with mental health issues that are seeking support to live with a condition, then I'm much more along the lines that Alison Ward was describing around service user or even a customer of the service, because actually they're interacting with us to help them, to support them to live their lives, as opposed to actively seeking healthcare. So the patient terminology is very important in the NHS. It's important in the context of the relationship between doctors, nurses and individuals seeking acute support and care when they're unwell. And I think it's an important term and something that the population values.
Thank you. We're already receiving quite a few questions coming in, so I'm saying thank you very much for these questions. Please keep them coming in. I do appreciate them. So we're getting quite a diverse view already from two of the panels. David, can I come to you?
Yeah, I think it is something important that needs to be considered, because it does really reflect and set the tone of your relationship with your service users as well. And it also reflects that relevance, to how you label what you're doing in terms of would the person who uses your service connect. Do they see that as their title of who they are as well? So there's no good advertising, getting involved, engage with us, we're looking for service users if they don't see themselves as a service user. So it does need some discussions with your service users as well. But it might be that you do end up needing slightly different names. We touched on this already, reflect. So your service users could be at different stages of your service. Your service is so varied. In housing we have applicants, they're not yet tenants, but they're still a customer, perhaps they are. But yeah, I think it's important to reflect that. It may be that you need to choose that where they are in that sort of line of your service really as well. And it is, particularly in housing we've had a lot of discussion with tenants, what they want to be called, customers, residents, tenants. And there's a bit of course to reflect that. We want to be known as tenants sometimes, because it reflects that legal relationship you have with your landlord as well, in terms of rights and responsibilities on both sides as well. So there is that approach, the legal relationship you may need to think about within your own organisations as well. But I entirely take the point of view around customers could set the right culture for an organisation in terms of service provision as well. But I think the message really for me is, you need to have that discussions internally with your service users, try and reach some sort of decision on that. Because what's important you have is some consistency across your organisation in what language and interpretation you're using, and even with your partner organisations. If you want to go out and engage with people, there needs to be a consistent message going across your organisation.
David, thank you. So I'm hearing a lot of consistency about the relationships coming. That's one of the key themes that's coming through here. Fran, can I have your perspective on this, please?
Yes, I mean, I agree with a lot of what's been said, and a lot of it for me is actually about the relationship, the power relationship in particular. So actually it's about trying to reach an equality in the power relationship, and up to a point it's actually making sure that everybody who is in the relationship between the service provider and the user actually understands and has a common understanding of what they what the term means, and that it's comfortable. And if we're talking about not just groups of service users, but individuals, I think there's a really important thing about asking the person, not making assumptions. And I know, there are examples in health around, you know, I think of my mother-in-law when she was in hospital being called Liz, and she's saying, I'm Mrs. Target. And actually, those sorts of things are very easy to get right on an individual basis. And maybe we have to take the same approach. We increasingly, as an organisation, we talk about our clients. Now, that implies we are doing something to them rather than with them. And I'm with Alison here. I think customers is a very good one. But we also just talk about people. So when we are talking about our policy work, we talk about doing that for the people of Wales.
Sam, thank you. So one of the clear messages I'm getting about the relationship status is very important, but I'm also getting a very clear message that it is not a one-size-fits-all approach. Can I say to those people, delegates who are actually listening in, thank you very much for your questions about complaints. It's coming through loud and clear. So I'm choosing one question about complaints to represent what, the overarching questions that have come in. It's not being directed to anyone particular, so I'm going to go and place the question to the panel, and I'm going to take Alison's response to it first. So the question, I'm going to use this question as an example about complaints. How should we deal with complaints made when people feel let down? How do we learn from this? So I'm going to come to all 4 panel members about this question. I'll just repeat it once more because you need time to have a bit of think of it because this is a live webinar. So the question that I'm choosing about complaints is, how should we deal with complaints made when people feel let down? How do we learn from this? Alison Ward, can I come to you first on this one?
Yes, you can. Well, you can imagine, being the Chief Executive of a local authority, I see a lot of complaints, and some of them are justified and some of them aren't. And I think that is one of the problems with complaints. You can get people who've received a very bad service, you can get people who've just not received what they want, and you can get people who, you know, are just not on this planet. You know, we have the whole range of people. But nearly always we can learn from complaints. It may not be that we've done anything wrong. It may be that we've followed procedures that we have to follow. But I think there's 2 things. It's what we've done and how we've done it. And usually, even if what we've done is correct and there's no grounds for the complaint, if somebody's complaining, it's usually about how we've done it. There's a very small part of the spectrum of people who will never be satisfied, however well you treat them. But a lot of people just want to be treated with respect and feel that they've been listened to. And I know there's a lot of research around the better you treat people, even if they don't get what they want, the less likely they are to complain.
Okay, thank you for that. Alison Williams, may I come to you?
Likewise, as the Chief Executive, I deal with a lot of complaints as well, but I think we need to put this in context. Of all of the contacts with the NHS, 0.1%, less than 0.1% of people complain. But that is rich information that we need to learn from. In my experience, there are probably 3 key things. One is we've got to deal with things better in the moment. And that's about empowering our staff to say sorry and to say whatever the rights and wrongs of the situation, if you are left feeling that way, we have to acknowledge we've let you down. That's not saying that we've done anything wrong, but it's acknowledging how the individual has been left and made to feel. And often doing that in the moment actually is what people want and cuts off a lot of the bureaucracy around complaints management. And we've interestingly putting in a system where we can identify complaints that we can deal with very quickly. We phone people up the same day and try and deal with them on the spot, and it's working very well for us. The learning is really, really important because it's about the feedback that we give back to our staff at grassroots level. Even if that is, look, we don't believe that you did anything wrong, but you need to reflect on the fact that this is how the person was left feeling. And that is powerful learning. What I would say, though, and maybe we'll come on to this a bit later on in the webinar, that I'm as interested in learning from the 99.9% of people who don't complain as the less than 1.1% of people who do. And when it comes to engagement and learning and service improvement, that's almost harder to do.
Alison Williams, thank you. David?
Yeah, I think out there in the sector, I think that people willingly want to be rushing out and complaining about everything. Ultimately what they want is a good service. And often the time, those complainants, they've got ideas which they can help you shape and change the service because they've experienced the complaint themselves. So that there's partly that, we talk about learning from complaints, but making sure there are systems in for that to happen and happen fairly timely, and that your complaints processes and learning from this quite responsive. So, if you're acknowledging something's happened, there's some wrong in some paperwork or information, that's an approach that could be changed fairly quickly rather than going through policies and different procedures. So it's having that fairly fast. I think engaging with those people who've made the complaint, really tease out what it was, the nature of that complaint, what made it better for them, and use those complainants as an opportunity to engage further.
I'm hearing opportunity and engagement, Camille, thank you. And finally, Fran?
I guess I'm in a slightly different position because I actually hear lots of the complaints about public services.
One of the reasons why you're sitting on the table this morning.
And I think from that perspective, I would say that honesty, clarity and immediacy are the most important things that our clients are looking for when they have a complaint about something that's gone on. And I think it's often more about the process and the way they've been treated than the actual piece of work that has been done. That is most frequent. And I think the feedback loop is just really important. As an organisation ourselves, we had a feedback loop. We still have it to a certain extent. That no one answers the phones in a CAB. Well, actually, I can tell you they do now because we used our complaints feedback that was the case to re-engineer and completely change the way we provide phone services. And I just think that actually we should see these complaints as opportunities as well as actually dealing with the individual.
Fran, thank you. There's a response coming for Alison Williams in terms of your about the first question was asked. So, what have your users told you that have helped you change services for the better?
Oh gosh, an awful lot of things. If you can just indulge me for a moment.
Happy to do that. Happy to do that.
And the one that really stands out for me is a chap called Brian, who when we were redesigning our mental health services, and we had a view about exactly what the shape of the service needed to be, the access criteria. He had been a complainant that then engaged in a redesign process. And actually rounded home to us that we were over-medicalising the process, and that as a service user with an enduring mental health problem, what he actually wanted when he knew that he was becoming ill was somebody to speak to him quickly, and it didn't need to be a doctor, and that he just needed somebody to talk to. And through his complaint and through his engagement in a redesign process, we actually tipped the balance of our service. It ended up with us reducing our beds by 50%, investing in significant numbers of low-level interventions in the community, and we went from 100% of beds at 120% occupancy to 50% of our beds at 75% occupancy, and saved a lot of money. And that was all about listening to an individual and then testing that thinking with others. So thank you, Brian.
Thank you, Brian. I've got one more question I'd like to pose to the panel. It's about sort of using service users who frequently join in a particular activity, raising a particular issue. How do you use them to get a wider sort of feedback about services? So they've engaged about one particular issue. If someone's engaging with you, how about using that as a sort of a sounding board to get sort of more wider perspective on that service in general? So there's quite a few of these questions have come in about sort of the single issue sort of inquiry, and then broadening it out to use them as for feedback purposes. Anyone got any thoughts about that one?
Can I give you one brief one? It's Alison Williams here. I think that if you've got a brave complainant who is not on a crusade, but is genuinely wanting to help us improve services, there's nothing more powerful than putting them in a room with staff. To actually have the direct conversation to say, this is what happened to me, this was my experience, this is how I was made to feel, and dealing with that at an emotional level with caring staff is incredibly powerful. But it takes bravery on the part of the complainant and on part of the staff to actually sit and have that honest conversation. But it won't work if somebody's on a crusade.
Okay, thank you for that. Alison Ward?
Yeah, well, I agree about the crusaders, and I think we have to be very honest that there are some people who, you know, it isn't possible to deal with effectively, but the majority of people are not in that category. We have a people's panel, so when we get somebody, you know, who's a normal, sane complainant, we're very keen to say to them, you know, would you like to join the people's panel, because the more people we've got on that, the richer the picture we get.
Great, okay. Samuel, thank you for that. Can I say share to the delegates, thank you about your questions about sort of using complaints to shape some of the strategic direction. I'll be coming on to that in the next question, so I'm not ignoring your questions about that. I'll pick them up in the next question if that's okay. Thank you for your questions. Please keep them coming in. So to the panel, I'd like now to move on to the second question, if that's all right with everybody. That question is, what are the strategic benefits of improved use of experience and engagement? Alison Ward, can I come to you first on that one, if that's all right?
Yeah, I think this is a very important question, because we are moving into times that we've never known before in terms of financial constraints, and we really have to make sure that we're doing everything as efficiently as we can. And one of the most important things is to understand what people need as opposed to what they want, which is not necessarily the same thing. And I think in the past, public services, local government certainly been very paternalistic, and we've actually sort of said, this is what you will have, without actually asking people whether they need or want it. So understanding what people need and what they want and being very clear about that can help us to target services where they're absolutely essential. And it's also about rights and responsibilities. I think people are going to have to take more responsibility for the way that they lead their lives, and expect less from public services in terms of rights. Well, that's a conversation. If you just try to take something away from somebody without asking them, they get very angry. If you have a conversation about what could you do more so we can work together on this, that's a completely different conversation. That's the one I want to get into. And just to say as well that failure demand is extremely expensive. So if we keep on doing the wrong things and we don't listen to people when they tell us we're not giving them what they want or need, then that costs us a lot of money. And listening to them when we get it wrong, or before we start doing it, that is a way of getting it right.
Thank you for that. Thank you. Alison Williams, can I come to you, if that's all right?
I couldn't agree more with Alison in the whole of what she said. And there are parallels across all public services in this context. Redesigning services is an absolute inevitability given where we are at the moment. And redesigning services is not about taking things away. And a lot of the time it's about improvement. But actually, people are very suspicious of public services. The history has not been good because people have seen change as loss. And unless we have a continuous dialogue with people about, both the difficulties that we're facing as a nation, with growing demands, with changes in demography, with the financial settlements for public services, then the more that we're honest and have those conversations with the public, actually I genuinely believe the more understanding and the greater participation we'll have in the redesign process. I think sometimes we're too afraid of public services to be really honest with people about how difficult this is, because we fear the response. Actually, when we are very honest with people and we properly engage them in those discussions, I never cease to be surprised at how open people are to change. A quick example is, discussions with the community about why they go to A&E, why they dial 999, why they use their GP services in the way that they do, and genuinely trying to engage with people about what those alternatives are. And sometimes it's about sharing the harsh reality. If you dial 999 because you've got backache you've had for 6 months, you could be denying somebody who's having a heart attack an ambulance. So this rights and responsibilities is a critical one. Finally, this shared understanding with the community, we have a huge amount of work to do so that they genuinely understand the tasks that we're facing.
Alison, thank you. For delegates listening in, there's a great sense of passion around this table this morning. I'm hoping it's coming through to you, because I can just, if we could bottle this passion, we'd make an absolute fortune. So even though we've got a panel from right across the public services in Wales, I'm getting a sense that there is a sort of common thread coming through here. As delegates, is that what you're thinking? Have you got questions you want to pose to us? Bring them in. There are quite a few questions coming in about complaints in relation to using complaints and information to shape people's, to shape directions of organisations. I will come back to that, rest assured. But now can I turn to David to have his perspective on this?
Yeah, in terms of strategic direction, I mean, we all know in these quite tough, challenging times, it's really important that any sort of strategy which your organisations develop delivers outcomes in a way. We'll get scared of outcomes, whether that's making people healthier, wealthier, wiser, safer. You need to really focus on those outcomes. And by engaging with service users, you can use those to actually evidence, have we delivered on that strategy? Have we delivered those outcomes? There's also engaging service users, helping to shape that. What will make it work? What will deliver those outcomes? Because often it's around talking, those conversations with those users. It's actually teasing out what is the bit of that service that really delivered that for you. There's huge services out there, but what was it? Was it the personal approach? Was it the written information? Was it the guidance we gave? What was it that actually hit home and made you healthy, wealthy, wiser, or feeling safer in your communities? So using service users to really evidence it and really shape, your future direction really as well. And one approach, particularly these days, is you might want to engage service users, particularly around thinking about your strategies, trying to help around those frontline services, so those can be sustained and retained in communities. And there's preventative services. If we can get those right, get service users talking about those, how we can shape those differently, and stop organisations being sort of, a crisis service, which we all know costs a lot more. So engaging service in that sort of area of work.
There's some linkages between what you've been saying, David, and what both Alisons have actually been saying in terms of sort of the preventative approach here. I'm seeing there's the preventative theme beginning to emerge. Fran?
Yes, and I think I probably would continue that theme, because I think that there is something that's really important about using this, people's individual experience and engagement, which means that actually what we can end up doing is, if we're not careful, doing the wrong things really well, instead of listening to those people and actually doing the right things. And that can be transformative. And if we are in difficult times, and I think an organisation like ours also has to understand that in terms of what's happening in the sector, and it's about redefining some of those relationships, and we will never do that as deliverers of public service rather than public sector without actually talking, engaging with people, and actually making sure that we understand people's expectations and their experience, because that is valuable to us all in our redesign.
Okay, Fran, thank you for that. So I now have the challenge of posing the killer question to the panel about sort of using complaints and service user feedback in order to help shape strategic direction. So got several questions come in about this. So I'm going to open up the panel. I'm not going to say just because Alison's and Ward's on my left hand side, I'm going to keep coming to you. So the questions are framed around using information from service users to shape strategic direction, stroke using complaints to help shape a strategic direction. What's your thoughts? What's your views on that?
Shall I go first? Is Alison Williams here? I think we need to be careful here, because just using the example that I gave earlier, that it's less than 0.1% of people who complain. The risk is that if we overly rely on complaints to help us to redesign services, then we're not focusing on the majority of the people who are going to be using those services. So complaints are a valuable source of information, but as I'm sure we'll go on later on in this webinar to discuss, there are multiple other ways in which we need to engage with multiple other sectors of our community, so that we have a genuine rounded view of what people want from our services, and not just have that overly focused on the views of a small number of complaints, but at the same time recognising that people making complaints have a valid point of view which needs to be considered.
Alison, thank you. Well, that leads on to another question I'd like to pose to the panel, because the question says, do you see a difference between engagement and participation, and what would this be? That's a very interesting question, isn't it? So, because the panel have not seen these questions, I'm reading them out to them live, so I'm going to show you this. So I'm just going to repeat it again to give them time to have a think about it. Do you see a difference between engagement and participation, and what would that be? So, Fran, can I,
it took a breath in.
It took a breath in, yes.
I get to answer it first. I think this is actually quite a difficult one to get my head around. I mean, I suppose from my perspective, I think the difference, as I'm interpreting it, is that engagement potentially means, could mean the communication streams.
Yeah.
It could mean talking to people. It could mean going out there and explaining things. I think genuinely, if you turn that into participation, what you are moving into is something that I think is really important, which is genuine co-production. So you are actually saying, not only will we tell you things and listen to you, but we will actually give you a place in the redesign.
Okay.
And I think for me that's the difference. Now if we can get to, and I think we have to be careful, because there will be times when engagement is the right thing to do.
Yeah.
And there will be times when actually the redesign will be better with full co-production across individuals who are users of services.
Fran, thank you. David, I could see you nodding there quite a lot to what Fran was saying.
Yeah, I think it's, again, it comes to a lot of terminology, which is often, in housing we see as landlords using the word involvement as well now, as well, so it confuses it sometimes even more. But it is important because, it does set the tone of your relationship, and sometimes engagement can be seen as something that we do to them. We engage with you.
Yeah.
And nobody in the real life uses the word engage. I'm not going to engage with you.
No, I'm going to have a chat with you, aren't I?
Yeah, and
that's what it's all about, really, isn't it?
So again, language can be important, in terms of what message it portrays. But really, picking up the point there earlier around participation, it does start to open the door more. They're actually, with you. They're playing a bit more of an active role with you. They're a bit more involved with you as an organisation. And want to work with you, participate with you together, hopefully directly to improve services. Yeah, but for organisations might be at different levels in terms of what your culture and ethos is ready. You're not going to suddenly may not be ready for full participation just yet, and that engagement may need to happen to build up relationships, to build up trust, ready for those for your service users to participate.
David, thank you. Alison Ward, can I bring you in this, because what you said at the beginning of the webinar is that sort of some services are people come to you for because they want them. Some of them they don't have any choice in the matter. So what's your response to that?
Well, I think we've got a spectrum actually of going from, at one end you've got just communicating with people, saying this is what we're going to do, then consulting with them, this is what we're going to do, what do you think about it, engaging them, having a proper conversation, participation, actually getting people involved in it, and at the other end of the spectrum is ownership of delivery.
Oh, new word coming in here on the panel.
That spectrum, I think we're going to have to go, if communication's on the right and ownership's on the left, we're going to have to start, I've written it down, we're going to have to start moving more and more towards the left so that people more and more own and actually personally deliver the things they need for themselves. And I think it's a very interesting conversation.
Thank you, thank you. Wow. David, I'm just giving you the heads up that there's some questions coming in about the role of housing in a minute and involvement in the comments you said there. Alison Williams, I need to ask you a couple of questions that have come in about your view on the relationship based on commissioning. Contracting perhaps within specific based approaches to third sector. They've mentioned it. I think this might be meant for you, Fran, actually. I'm not sure if it might be both of you, but they've actually mentioned your name. Does the panel have a view on relationship based on commissioning? Contracting perhaps with specification-based approach to the third sector party service provision. Whew, that's a bit of a mouthful, isn't it? Yeah. Okay.
Shall I have a go? Shall I have a go?
Would you like to have a go?
I may not have understood the question.
Yeah. I was just going to say, can the person who actually, the delegate who sent in that question, can we seek clarity on that one? Because I'm getting, just rather than get the panel to have a think about it, can you just give us a bit more heads up what you actually mean? And we will come back to your question if that's okay. In the meantime, there's another question come in. How do you share power with people? Oh, now then, who's going to pick this one up first?
I think that power is a really interesting word in that context. And And what do we mean by that? Do we mean that we share the responsibility for decision making, for actions that are coming out of the relationship? Because if that's the case, and I refer to the health relationship here, the importance is that in decision making, that ultimately the patient is the person who makes the decision about their own choices and what really the options are that are going to affect the rest of their lives. We come from a history where you did what the doctor told you to do.
Yes, we did.
And the doctor was seen as all-powerful. And a very funny story, as a student nurse, I went to visit a lady who had a very serious heart condition. She had 9 children. And we went to see her after her 9th child, and the midwife that I was with said to her, really, you're putting your body under huge strain by having all of these children, and if you're not careful, if you keep getting pregnant and having children, this is going to have devastating effects for you. She turned around and said, it's okay, love, as long as I don't get married. So what do you mean? Well, the doctor told me when I was 17, don't get married and everything will be okay. So she never got married. You know, it sounds like a funny story. The outcome was she didn't have any more children, and she and her partner actually got married. And they've been together all of this time. But that power of a doctor saying something is really, really critical. So for me, this relationship is not about transfer of power, but actually empowering people to make their own decisions, giving them the information, giving them the support, and sometimes giving them permission to make a decision that might be counterintuitive.
Thank you. There's a very powerful question coming into the panel now, so I'm giving you the heads up. How well do you think we do in multi-agency engagement? David, I'd like to come to you on this one first, if that's okay, because they're asking sort of about, you represent a particular sector in public services in Wales, and this is about taking the level up outside your own sort of comfort zone, if you like. Are you happy for me to come to you first on this one?
I think it's going to need to be an increasing area where agencies and organisations do need to work differently and work together more. I mean, not only does it help address confusion with community members, service users, you know, in some communities there's so many different initiatives, so many different organisations and organisations operating. When you say to them, get involved, it's uncertain for them, what am I getting involved with? What do all these different organisations do? And that's quite off-putting in itself, really. I mean, there's some obviously different terminology and language even within organisations. I mean, I'd probably struggle to work with health. No offence, but in terms of some of the language used, I wouldn't know where to start in that language. So there's some, obviously that needs to be explored. Perhaps start off a very local level, where you're working locally on the ground, focus on a clear purpose really, and what you're all trying to achieve.
There is a sub-part to that, David, that's come in, and I think it'd be sensible for me to ask it, because they're wanting to know, are there any specific key skills and engagement that they should be considering trying to move to take that step up to sort of a multi-agency approach to engagement. So I'm going to come to Alison Ward next on that one. So I'm going to combine both questions. First, about sort of looking at it about a multi-agency approach, and also what key skills do you think that would be required for staff to be able to achieve that sort of cross-sector engagement?
Yeah, multi-agency working is absolutely essential to the way we're going forward, because you know we have to pool our resources effectively across a strategic piece. For me, it's, I hate to quote Tony Blair, but he said education, education, education. For me, it's relationships, relationships, relationships. And a lovely phrase that I've heard, which I quote often, is it's about changing the culture of power to the power of culture.
Would you like to repeat that? That is such a powerful statement.
It's about changing the culture of power to the power of culture. And if you exist within a culture of effective relationships where of mutual benefit for joined up strategic aims, is the only way forward with the resources that we have at the moment. We can't afford to carry on being as we are.
Thank you. Can I add to that? Because I actually think that our staff at grassroots level are much better at doing this than we are. Because the people who are genuinely interfacing with the service user, whether that be the social worker, the district nurse, the community first worker, the housing officer, I think that they have a much less bureaucratic, procedural way of joining up their communication and engagement around the individual. I think there's a lot that organisations could learn from that. And where it's important that we do that in a joined-up way, we do it around the individual and not around the service.
Awesome, thank you. Fran, can I come to you on this one?
Yes, I mean, the original question was how well we do with multi-agency engagement, and my answer is curate's egg. Sometimes it works really, really well, and sometimes it doesn't happen at all. So I think, you know, we need to do some learning from where it's doing well. And from my perspective, the things that make it work well, I absolutely agree with Alison that relationships make it work. And actually, that isn't something I think you can teach. I think it's something that people have to pick up by seeing it happen. And it is about power, but it's more to me about trust, actually. And somebody also, you know, if I want to quote, once said to me, which I think I found very important, that actually people don't trust organisations. People trust individuals. And so actually it's throughout our organisations, allowing people to be honest, to be clear, and that then engenders trust with other people.
There are several questions come in as you were giving your feedback on that particular question. Did the panel have any specific examples where multi-agency sort of engagement has worked that they're aware of? Not necessarily within their own organisations, or it could be from you might be aware of other case studies. So they're asking to be cited over any case studies or approaches of multi-agency engagement you may be aware of. So I've just told the panel this question. I need to give them a bit of time to have a think about that one for a minute. Just to say thank you very much for all your questions coming in. They're coming in thick and fast. I apologise, we can't answer every single question. What I'm trying to do is trying to group the questions as they are coming in. So there's one question coming in about sort of case studies of any case studies they're aware of where that's happened. There's one other question about how do you triangulate user experience from different sources to provide evidence for the need of change. So I'll repeat that one once again. How do you triangulate user experience from different sources to provide evidence of the need for change? I will now go back to I'll ask the panel, does anyone have any examples that they're aware of across the UK? I won't limit it to the UK because I know quite a lot of you take sort of research from across the wider world, if you like, because the web enables us to do that. So, Alison Ward, can I come to you first?
Yeah, a local example, actually. One of the things I'm most proud of being involved in is the Gwent Frailty Programme, which was a multi-agency programme where we started by engaging service users, older people, and just saying, what do you want? And they said, we want to be independent and we want to be happily independent. And then grouping a whole range of different agencies from the statutory service, from local government, health, and the voluntary sector, and pulling together all of our efforts under that one top of the pyramid sort of goal, which is that frail people will be happily independent. Lots of evidence about that.
We've got a website. We can share that afterwards. So the delegates who are listening in, we'll ensure that information is shared afterwards. Fran, can I take your response to this one before we move on to the next?
Yes, I mean, just again, it's a relatively local example, but for us, there's issues around obviously the introduction of universal credit, which is coming down the line. Wait and see, but actually, the place in Wales that has seen this ahead of anyone else is Flintshire. And I have to say that the way that there has been a real multi-agency approach to the issues, which has included the housing sector, the local authority led by the local authority, the advice sector, has actually really made a difference. And I'm delighted that Flintshire are going to be leading on some of the training for other authorities around this. So I think those things, and they are back to what Alison Williams was saying, they're actually people on the ground locally doing it well.
Fran, I would have to ask, can we provide further information for delegates? Thank you very much. So 2 more questions before we moved on. The first one is about How do you triangulate user experience from different sources to provide evidence of the need for change? Quite a deep question we have here. Alison Williams, I'm looking directly at you to pick this one, if that's okay.
I'll have a go. I think that what we have to do is we look at multiple ways of engaging with people and what are all of the sources that are already out there. So we might come on to that in a moment under the next question for the panel. But for example, we have to use complaints. We need to use incidents where things have gone wrong, which don't necessarily result in a complaint. We use compliments.
Yes.
And we use feedback from our staff, because what we must remember is our staff are also our service users.
Yes.
So if I take Cymtal, we have 8,500 staff who are all a part of families who live within our community. So I think that our staff are a very, very rich source of very well-informed user experience. And we take all of that information as well as the formal proactive engagement processes, which we'll come on to in a moment. And we have to assimilate all of that to inform the change that we undertake. And we do.
Thank you. Thank you to the delegate who's given us clarity on the commissioning question. And I'd like to address it to Alison Ward, if that's okay. So the revised question reads like this. The commissioning question is about getting the relationship aspects right, so that there's no need to micromanage the details. Alison Ward, would you mind picking that one up for me?
No, not at all. I think when you get this right, you've got this kind of magic relationship between the people at the top of the organisation who have the power to make things happen, and the people at the grassroots who actually know what the problem is and know how to solve it. As a chief executive, I don't know how to solve it. I need to get the people at the grassroots to believe that I am empowering them to do whatever's necessary to solve it. And I think if you do have that kind of very clear overarching goal with an emotional imperative behind it, we need, we're all in public service because we want to make a difference to people's lives. So here's this thing that we all want to do really well. And then you empower, at the top of the organisation, you very clearly empower the people lower down to deliver that. And then you let them get on with it, and you have a no-blame culture where you say, I want you to try your best, I want you to push the envelope, and if this doesn't work out, you won't be blamed, you'll be praised for doing this. It's all about that kind of culture which has to come from the top of the organisation. As long as you try to micromanage people and control them, they'll never step out of their comfort zone for fear that will rebound on them.
Alison Ward, thank you for a very honest question. I do appreciate that. So I'm giving the heads up to delegates who are listening in now that we're moving on to the third question. So the question is, what are the barriers to effective strategic use of engagement and experience, and how do you overcome them? Please don't wait to send your questions in. If you've already got a burning question, please email it through. So Alison Ward, what are the barriers to effective strategic use of engagement and experience, and how do you overcome them?
Well, I think the barriers are that often the people who most need our services are the ones that are most hard to reach and the ones that are most disempowered in terms of saying what they think. And I'm sure we've all been in meetings where you go to a village hall where there's, sort of 20 people turned up and a couple of people with very loud voices. You don't want to hear from them. You want to hear from the, the single mums who can't get out of the house because, of all the things that they have to deal with. So the barriers are around reaching people effectively. And for me, we are blessed, although cursed in other ways, with the new ways of communicating. Twitter, social media, Facebook, ways of reaching people in ways we never could before. Because nearly everybody, even in quite disadvantaged situations, has a mobile phone.
Yeah.
We've introduced a Torvine phone app. In our council. We've already got 25,000 users out of a population of about 93,000 people. And basically, if you see some fly tipping, for example, you just take a photograph of it on your phone and you send us a photograph. You get an automatic geographical location and we go and clear it up.
Can we share that app with Delegate?
We'll
put that information as a resource after.
Yeah.
Thank you. Thanks very much. Because I've seen that app and it's really a powerful app. It's so simple.
And it cuts out a lot of bureaucracy.
Yeah, and all the change. Lovely, thank you. Alison Ward, thank you. Alison Williams, can I come to you on this one?
I'm at risk of being boringly repetitive here. I think the real issue is that we've got to get to the people who will not normally engage, as Alison was saying. And again, if I can give you an example, we went out and engaged on maternity services, big public meetings, very large numbers of people present, 70% of which were over the age of 60. Who are not going to be having children, we're not going to be accessing maternity services. No. So, you know, it really is about getting to the right people. We then used a social media approach and did a live web chat on a Friday tea time, which we thought was a good time to be accessing people, and in that 1 hour got access to 3,500 women.
Wow, wow.
So it really is the old school approaches, which is about you know, the church halls, the big public meetings. They still have a place, but their place is becoming less and less significant, and that we've got to find different ways of getting to the real people. And actually, when you're talking about designing services, it's not necessarily the current service users you want to be looking at. You want to be looking at the people who are going to be using those services in the future, because some of the lead-in times for our service change are, you know, years, not months. And so when you're looking at maternity services and what they're going to be looking like, actually, teenage girls, young people, the youth community is a community that is not engaged with public services generally, but actually are going to be our future service users. So for me, it's about getting to the right people and using all sorts of means of doing that. Can I come quickly back to a point that Fran made earlier? Trust is critical. And the individuals fronting this are critical. It's about getting our frontline clinicians, leaders, as well as the faces of, you know, the chief execs and other people out there, because we've got to build trust with these service users.
Okay, Alison, thank you. And as we're touching on the subject of social media, Alison Ward started talking about it. We are getting a raft of questions in, so I'm giving the panel a heads up. There's going to be quite a few questions about the use of social media, sort of, and the response, and how you're using it. So just warning you now, there's about 5 or 6 questions already coming in. Please feel free to keep coming in with your questions, folks. Thank you for all your questions and participation, much appreciated. David, can I come to you on this question?
Yeah, I mean, there's plenty of barriers, we just already touched on some. And what I always say to some landlords is, you know, you think about, you know, clearly think about the relevance of what you want to engage about, you know, who you need to speak to, really. And when you sort of thought of that, put yourself in their shoes. You need to be thinking about what their barriers are. You know, what would exclude them? You know, it could be times of things, literacy, language, childcare. I've often seen adverts to come to our local boards of service panels and boards and things like that. It doesn't tell me what time it finishes, it doesn't tell me if I can bring the kids or not, it doesn't tell me who's going to be there or anything like that. Is it a drop-in, or is that to sit there for an hour? And so you just need to be thinking about what would make them want to come, what questions would they want to know, you know. So they can make an informed decision about commitment levels and views as well. Is there some sort of reimbursement of travel costs or anything outside that? Particularly when they try and include your underrepresented groups as well. You need really to do your homework on that. And probably the second point I mentioned outside is around, before you even do some of that, you need to really be making sure your organisational and governance culture is ready for it. What you don't want to do is sit on the road of, we're going to engage, we're going to talk to people. If processes aren't really in place behind the scenes, you know, you're wasting a lot of people's time then, and there might be some homework, things you need to do, changing mindsets, changing people's approaches, might be internal training for staff, and things like that. So think about your back office type, your internal things, then go out and engage.
David, thank you. I'm hearing some very powerful messages here, but also not a one-size-fits-all message that's coming across quite across. Fran, can I come to you with this finally, if that's okay?
As the over 60 on the panel, I'm delighted I'm going to get maternity services. Sounds good to me. I mean, rather than repeat things that have already been said, I think one of the things that I'd like to think about is actually the barrier, which is actually that some of us think that we feel we should know the answers, and it's too embarrassing to say we don't, so we don't engage.
Okay.
you know, but we're actually driven to assume things because it would be just really embarrassing to say, I don't know, and actually how powerful and empowering somebody saying, I don't know the answer to this, can you help me, could be. And the other thing is actually, I think there's a real barrier in terms of people's habits. You know, we have a habit of just getting on with things, making things right. We think we are in the business of putting things right rather than finding out what needs to be put right, because it may not be what we think it is.
That's a powerful statement to end on that one, isn't it? Wow. Thank you, Fran, for that. Thank you. So I gave the panel a heads up that we were going to be talking, there's quite a few questions about social media. So I'm going to take this question because this question kind of represents the 5 that have already come in. In a world of social media in a world of social media, organizations are expected to respond quicker than ever before. Have you used social media to engage or to gather experience? Alison Ward, can I come to you here first?
Well, yes. I mean, I've talked about the Toolvine app, and obviously it doesn't just enable us to deal with things. It gives us a rich picture of what people are interested in and what they want.
Okay.
We use Facebook. We use Twitter. I think the issue about having to respond immediately is a very difficult one, because there is an expectation in society now that I will ask for something and I will have the answer within half an hour. I can Google something and get an instant answer. But as organisations, we just can't turn around that quickly. And I think the danger is that we become more responsive to people who use social media and less responsive to people who use more traditional means of communication.
So my question, my sort of response to that would be, how do you strike that balance then? Is it, you know, it's about sort of managing expectations. And we are still learning in the world of social media. What are your early lessons, I guess I'm going to be asking you here?
Well, I think the early lessons is that you know, we have a whole system around how soon you can expect a response to a complaint. And if somebody writes in or they email in, then we follow those guidelines. The danger is we then get something on Twitter or something on Facebook and we go, all right, we must immediately deal with this. And we haven't got it right yet. I'm not pretending we have, but what we have to do is be much more disciplined about saying, whichever channel it comes through, we deal with it in a consistent and fair way. And the temptation is to be very responsive, very quickly.
And it's about manage and ensuring that message is shared with users, with whoever sent that message in.
And that's about setting service standards, which may need to be revised in the light of social media.
Okay, thank you. Alison Williams.
I couldn't agree more. And you know, one of the challenges that we had is if I want to buy a new washing machine at 3 o'clock in the morning, I can. But people can't book a GP appointment or speak to a doctor in the same way. So there is something about genuinely having to manage expectations of people. And again, back to Fran's point, being very honest about that. What I would say, though, is that, and as somebody who's not a confident social media user myself, I still get a bit scared when I sit in front of, you know, the Facebook screen and start a Facebook chat, because it is very immediate. It means that I have to be much more disciplined in how I answer things very quickly. It's a new skill and technique that we need to train people in public services to use. But what I would say is it's an amazing way of getting thousands of people to actually have the information very, very quickly. And it does avoid lots of repeat questions from people.
Because it's so open and transparent.
It's so open that, you know, if one person's asking a question, you can guarantee there are dozens of others asking or wanting to ask a very similar question. So I think we've got to train people better and we mustn't be afraid of it.
Thank you, Alison. David, can I come to you in this one?
Yeah, I think, you know, for a lot of organisations, landlords alike, it is a bit of a work in progress, and it is that fear, you know, and how much of a leap you take into social media, Twitter and Facebook, particularly when things are in the public domain as well, and how you control and manage any comments that come through as well. But, you know, it can be used, you know, there's organisations who've used it, things like have a Twitter wall, Twitter feed in for meetings, so you can't come to a public meeting, you can still feed in different ways, share comments with a certain hashtag on a certain theme. So, you know, it's around exploring other ways that you can fill it and better collate the data and information you get from it, really, because that's what you need to be thinking about as well. But it's also, you know, quite well used as a tool just to build relationships, really, for people who may normally not engage with normal channels, to actually raise awareness of methods, how they can engage, you know, what you're doing, different approaches, support available, signposting. So there's different ways of using it, but it's thinking about how, you know, the bigger leap, how to actually use it longer term.
David, thank you for that. Fran?
Yes, I mean, we're increasingly using social media with our campaigns work. So I'm getting direct stories from people, which makes actually our work to try and influence policy much stronger. We've done some really interesting things around, we have a campaign, Fair Pay for Prepay, about prepayment meters, and getting people to send us social media photographs of where their meters are and how difficult they are to use. I mean, just much more powerful than the statistics. And we're also doing things like piloting web chat, which is really fascinating, because what we're getting is a completely different set of clients coming to us. So it isn't decreasing all the other places that people come to us, but we are showing that over lunchtime we have higher web chat, and we have more inquiries about employment issues than we do in either our face-to-face or our phone services. So actually it's very powerful because it shifts actually who you're getting to.
Fran, thank you. I'm conscious of time. Can I say to everybody who's sending their questions in, thank you very much. I need to move on to the final question just to give that panel a heads up. We've had a couple of questions coming in asking about the Wellbeing of the Future Generations Act and the Social Services Wellbeing Act. I'm going to ask the panel some of those questions once we've come to an end, because I don't want to lose this last question, if that's okay. So it won't be on the live now, but it will be on as part of the record, if that's okay. So panel, the final question of this webinar is, it's about your advice, about your experience. So what advice would you give to someone who wants to improve their strategic use of experience and engagement? Thank you. Alison Ward, can I come to you first?
Yeah, I think I'm going to sound a bit boring now going about culture all the time, but I think you know, culture is absolutely the key to this. Yeah, my colleague Alison mentioned earlier on about staff empowerment. I think absolutely key is empowering people at the front line who actually meet real people to be able to use that information to feed it back effectively. And have a mechanism whereby that feedback can then be fed into some strategic thinking. The other thing is to actually get people to look at, you know, what makes them successful, because most staff in organisations feel that they're successful according to how well they perform against the performance indicator. It might have nothing to do with what the customers actually want. Just to give a very quick example, just go back to planning for a moment. If somebody applies for planning, let's say for a conservatory or something, actually what they want is to get the answer yes. They don't mind whether it takes over 8 weeks, as long as they get the right answer. But the performance indicator is 8 weeks. So at one time, we were just cutting people off and saying no at the 8-week period, when we could have said no within 12 weeks. Now, that's the kind of thing you need to empower staff to do differently, so that you can actually get a much better customer experience and feed that into then, you know, what do people want.
Could I be brave and say about the relationship between customer experience and key indicators need to be reflected? Is that a...
Absolutely. I think that indicators, performance indicators are landed on us from on high, from Welsh Government, and I'm not quite sure how those indicators are reached, but it's certainly not through actually looking at what people really want. And there isn't necessarily a correlation.
And a very powerful message there from Alison Watt. Thank you. Thanks, Alison. Alison Williams, can I come to you?
Bottom line is this, if you're going to use patient experience and you're going to engage with people, it has to be authentic. You can't pay lip service to it. It has to be continuous so that we build trust with our communities, because if we only go and engage with them when we want to change something, then we're just perpetuating the sense that what we're trying to do is to diminish the services that people have access to. So it has to be authentic, it has to be continuous, and finally from me, you have to demonstrate that you've acted on what people have told you. Even if you haven't acted on what people have told you, you need to tell them why you haven't acted on it. Because if you want people to engage again, and we do want people to engage again, they have to know that you've listened. So that feedback loop and that authenticity is critical.
Awesome, thank you. David?
Yeah, in terms of your strategic approach, I mean, I think you need to see the engagement side as an investment, and having an investment longer term really. So you need to put the resources behind it, whether that's staffing, budgets, or whatever, time. And that's why I think, you know, when you're planning your strategy, you really need to try and embed sufficient time for it to happen. Because what you don't want people to think it's a done deal, and you definitely, you know, you're putting on engagement at the end of it all really. You need to be thinking, where is our timeline, where are we going to engage, and who are we going to engage with, and build it into that process really, and resources it accordingly. And think about what you've already got. You've probably got opportunities to engage already. I call them everyday points of engagement, which is when, you know, a frontline person's talking to somebody else, or when they're in an office, or they come to a reception. So think about where you can collate all this data and evidence already without having to create something totally new and expect people to come to us, because it's happening. Talk to your frontline staff. They're probably doing things in their communities. You think, well, can you do some of this? We have some feedback about this. So try and map out what you've got out there already. Think, will that deliver what you want to do? And picking up a couple of points made before, really, around the honesty side of things as well. And I think it's time. People know there's challenging times ahead. It's all on the news every day. There's less budgets, less money around. And I think there's time now for organisations to have quite frank and open discussions with service users about those days of doing that might be over. We've got to do something differently. How do we do that? And what's the tenant's priorities? What bit of the service do they really value most, really?
Yeah.
And try and tease that out of people and get that information. And being really ready there to respond. You know, have some quick wins, but also, as Alison's point was saying, give them the feedback. It might take, you know, months, years until something changes, but explain that to them. And also a bit of a thank you for their involvement as well. Goes a long way.
Powerful message to end there. Thank you, David. Thank you. Fran?
Yes, I mean, I think most of the points that have already been covered in terms of making it cultural, because I think that's really important. But the advice I'd give is that if you make it cultural, remember it's an untidy process. It isn't ever going to be neat if we do this well. And so actually accepting that is really, really important. And I think the most important thing from my perspective is that honesty and that clarity. Clarity that we can't necessarily do everything that people will ask us to do. And if we're not going to do it, why? And to make it real, and to make it real in the terms of that the people who have, you know, actually put it to us. I also think it's important in terms of doing this that we should accept the challenge to change. And sometimes we may have reached an early conclusion that it isn't possible when that isn't necessarily true.
Yeah. Great end to that one, Fran. Fran, thank you very much for that. We've had several questions coming in, and I've just tried to brigade it into one very simple question about culture. Everyone's asking sort of different aspects of culture, so I'm going to put to the panel an overarching question. What does culture actually mean to you in terms of service users? So what is this word culture? What does that mean? Can you sort of give your definition of it, if that's okay? So, Alison, do you mind if I come to you first?
No, I think the broad question of what culture means, I think, is about shared values for me within an organisation. So that in terms of customers, we share common values across from the top of the organisation down to the grassroots about what our values are around people, what our common goals and purposes are around serving people in the public service. Because, as I said before, everybody's in the public service because they want to do good. If they weren't doing that, they would be working in the commercial sector. And it's about respect and trust between managers and staff, and also between staff and customers. And I think there's a really important leadership role around role modelling all of this. If you say that to people at the front line, but you don't behave like it, then they will know you're a phony and they won't do it.
Okay, Alison Ward, thank you. Alison Williams?
I think you've just set a subject for another webinar. And I think every one of us could give a sort of 4-hour lecture on it and still not be able to understand the question. But for me, it has to be about the values that come from the top of the organisation and that distill all the way down to the grassroots level. And I'm sorry what anybody says, it does start from the top. And you can change an organisational culture or damage an organisational culture very, very quickly if it isn't top to bottom. What I would say, just by a very quick example, we did a piece of work in Gweminar looking at this. What were our values? What were our cultures? What was our mission statement? What were our core objectives? All of this. And we distilled it down to 3 words. Gweminar cares. That is what we aim to do. That sets our culture, that demonstrates our values, and that's what our service users, our patients, whatever we call them, want us to do. Because if we care, then we're far more likely to get it right. And we even care when we get it wrong.
Thank you for that one. David?
Yeah, I think sometimes, you go to a different organisation, immediately when you walk into an office, you can just feel the culture of the organisation, what sort of organisation it is, and instantly you know from whether it's how the staff are behaving, what's on the wall, the visuals you see, and this is what all your service users are picking up as well when they meet your staff, whether it's a front line, whether they're engaged in one of your offices, whether they come into one of your meetings, how's that laid out? Is there a top table straight away? Everyone with a suit straight away, there's a culture there that you're setting out. So just think around what culture you want to portray to your service users as well, in terms of, like I said, the language you might use in some of your literature, having the right staff in place to do the engagement, and that may be a bit of training involved there, or even thinking about it in the recruitment. And I say recruitment for all staff, back office staff, front office staff. Ask them a question about engagement, why the organisation does it. Get them to think about it. So set the tone straight away. You join us. This is what we're about as an organisation, and these are our values.
David, thank you. Thanks for that. Fran?
It's interesting being last, isn't it? Because I absolutely, values and behaviours is what it's about. But for me, those are fine, and Gweminar care is lovely, but it's how it's demonstrated. So it's actually, how is it seen? How does this look from the outside is what matters. So we can all have, I agree, the same values. We all have very similar values, I'm sure. But actually, are they genuinely inclusive, and do they look like that, somebody who is looking at us from the outside?
Fran, thank you. It'd be very remiss of me not to ask this final question, and this is putting the panel sort of absolutely on the spot here. As panel members, what are you taking away from this morning's webinar, from what you've heard from the questions, what you've heard from other panel members? And Fran, I'm going to break with tradition. I'm actually going to come and start with you first, if that's okay.
For me, I think it has reminded me how easy it is to fall into not listening, assuming and for me, it's actually about being more engaged externally and doing more internally around co-production, because actually that's got to happen.
Fran, thank you. David?
Yeah, I think there's some potential real opportunities as things evolve. It's sort of way to settle into a new era of engagement, particularly with challenging times and further cuts, but around potential to share more experiences between each other. Housing participation's been alive for some considerable time. It's evolved and it's changing. But I think between us, there's a lot of information, good practice, experiences which we can share, and perhaps combine and joint approaches.
Alison Williams?
The core similarities between us, I think, have really rung through this morning, which is reassuring for me as a public sector leader. But also the differences and how we can perhaps learn better from some of the differences between our respective organisations. I know this is live, so this probably is not necessarily the done thing, but for me, the further learning that I would like to take out of today is I would like to see all of the questions that have come in, and I would like to have a stab at answering them, and I would like to find a way, in whatever way this is ultimately published, to be putting those answers up to all the questions we haven't had the chance to answer this morning, because I think, actually, for me, more of the learning will come out of the questions that other people have asked of us.
Thank you. To respond to that, the answer is absolutely yes. All the questions are recorded because they come in via the webinar, and I will be sharing them with you all. We'd like to share it through our blog, if that's all right with you. We have a good practice exchange blog, a very informal way. We can either do a video chat with you, or you can write whatever prefers to you. So finally, Alison Moore, to close on behalf of the panel, what would your response be to this question?
Well, it struck me, I think, that we tend to struggle with these problems, which are very, very common problems, alone, or maybe multi-agency, but within our geographical patch. And it just strikes me that there's an awful lot of wisdom around this table. I wouldn't have thought of tapping into myself, and now I have thought about it, and I think, oh, there's 3 other people I can sound off to. But it's just we're not very good in Wales, are we, at taking best practice and learning from it, and I guess this is what it's all about. And certainly for me personally, there's been some learning, and that's fantastic. So thank you,
Alison. Well, thank you very much. Suffice for me to say, can I say a huge thank you for all of you sending the questions in. We will share all the questions with the panel. On behalf of the Good Practice team of the Wales Audit Office, I'd like to thank all the panel members from the bottom of my heart for your contribution today. And as I said at the beginning, if you could bottle the passion and the dedication on this table this morning, we'd make a fortune. So what's going to happen next? In terms of next steps, we are now going to edit the broadcast today and divide it into 4 easily listenable back sections, and you'll know when each panel member kicks in, and if you want to use that as a resource. Any resources that are actually mentioned, we will also highlight, we'll email that back to you. Here's my honesty here. As a way of sharing information and trying to encourage sharing and learning across public sector in Wales, this is a work in progress for us. How have we done? Have we helped you? Is there something that's frustrated you? You have an opportunity to share that. There's a feedback question I'm going to come back to you shortly. Please do fill it in. It does take only 3 minutes, I promise you, because without you sharing this feedback, today actually wouldn't have happened. A lot of the events that we hold and seminars that we hold as a result of the feedback from delegates. So please feel free to share your thoughts and concerns. And finally, for me to say, thank you very much for your time. I hope you've enjoyed it. Diolch yn fawr ar rhan Swydd Archwilio Cymru. Dwi'n gobeithio bod chi wedi mwynhau bore yma. Diolch yn fawr.